23 minutes before 11 o'clock right here on Power FM Zimbabwe. Good morning to you. And we are still looking at your health. And remember, every Thursday we also have Doctor on Call with Dr. Joe, who gets to come through, our resident doctor, who always gets to help us out. Today we're going to be taking your calls, 498-652 and 498-654. Those are the calling lines. Prefix that with 0242. Or you can get to come through on our Facebook page in the comment section, as we are live. We are live on Power FM, our Facebook page. So come through at Power FM Zimbabwe on our Facebook page, and we'll be reading your comments from the comment section. Good morning to you, Doc.
Good morning, Miss Rach. How are you doing?
Doc, I'm still sick.
So are you saying I'm not a good doctor?
No, you're a good doctor.
I'm joking.
You know when the flu starts drying up, right?
Yeah.
I know it's so.
To honey, chichi, so that your throat clears quickly.
I don't want to clear my throat. I want to clear my nasal congestion.
Ah, that one is easy. You don't have cetirizine and antihistamine?
Every day, maybe
it's actually hay fever. Maybe you're allergic to something.
I'm allergic to dust, hey?
Yeah, so that explains it.
Yeah. When you're trying to put off the doctor, but clearly he knows what he's doing. Thank you so much for coming through there, Dr. Joe. Definitely appreciate it. Today we're going to be talking about what I call indigestion, or maybe what I call, I actually call it irregular bowel movements. However, there's a medical term for it. If you can just explain what is the medical term for irregular bowel movements.
Yeah, it's called Irritable Bowel Syndrome. Irritable Bowel Syndrome, IBS, in short. No, not indigestion. Indigestion is part of it, but it's a syndrome with a lot of things. Indigestion is there, diarrhea, constipation, and things like that could come in, abdominal pains, and a lot of other things. So it's called Irritable Bowel Syndrome. Irregular bowel movements. Irritable Bowel Syndrome.
All right, so when we're talking about Irritable Bowel Syndrome, maybe explain to us what it is. From my own layman's explanation, or from my own understanding, I think it's whereby, you don't go to the bathroom on a regular basis.
Okay, it's a nice and simple definition. It means your bowel movements are not organized, or they're not regular. Usually people do have a pattern or a timetable. Some people say I go every time in the morning before I leave home. Some people maybe at night before they sleep. Some people go twice. But generally we say normal bowel movements should be at least once in 3 days. That's the minimum. At least once in 3 days. If you go for more than 3 days without passing bowel stools, it means you're constipated. If you go for more than 3 days, if you're eating normally and you go for more than 3 days without going to the toilet, you're constipated by definition.
What?
Yeah.
It's not normal?
It's not normal.
What is the normal time frame for someone to go to the bathroom?
We say once in 3 days to a maximum of 3 times in a day. If you go more than 3 or more times, then it's now diarrhea.
So if you go more than twice?
Okay, maximum 3 times. 3 times are on the border. But if
so 3 times a day?
3 times a day.
That's the normal?
Maximum.
Huh.
If you go beyond 3 times in a day, then it's now diarrhea.
Okay.
Yeah.
Which is interesting. And if I don't go for 2 days?
2 days is okay, but 3 days, more than 3 days.
More than 3 days, that's when you should be actually worried.
You should be worried. Because after 3 days, it's no constipation. If you go once in 3 days, it's okay. It could be your normal. But generally, most people, it's once a day. But if you do once in 3 days, it's still normal.
All right.
Yeah.
I want to get to understand, if you have irregular bowel movements,
Irritable bowel syndrome.
What can you do to make sure that you go on a regular basis?
Essentially, it has to do with diet mainly. Then also genetics play effect. There are certain people with certain genetic predispositions that make them not go so often or go too often. But the thing that you can do is something to do with your diet. So people eat a high fiber diet, your bowel movements are more stable. So if you eat more roughage, more fiber, more fruits, more vegetables, more unprocessed foods, it's better for you than someone who eats refined foods, eats takeaways, a lot of fats and proteins. That affects you. But more fiber, if it's minimal, make sure it's mgaiwa, like without, not the raw meal, not the palent. but this high fiber, there's this new palette with high fiber. It's actually good. So you need something with more fiber. If you do that, then your bowel movements will be more stable and they can be predictable. So more fruits, more vegetables, and also water. If people would drink plenty of water, at least 2 liters of water a day, and eat a lot of roughage, a lot of fruits, they do have regular bowel movements.
What about vegetables? Do they actually get to play a role?
Yes, they do play a role. If you eat a lot of vegetables, it's also part of the high fiber thing that we want. So more vegetables that you eat, the better for you. Your bowel movements will be more stable and your stool will be better formed if you eat a lot of vegetables than people who eat no vegetables or less.
All right, Doc. I think I suffer from this. I didn't think it was constipation.
Okay. How often do you go on average?
If I actually go once a week, maybe, or twice, but usually it's once.
Even he's shocked. Once a week.
That's why we're talking about it, Doc, because there are people who actually go through this. I eat a lot of vegetables, I eat fruits, I drink lots of water, I do all these things, but you still find that you don't go to the bath.
You don't have the age,
yes,
desire.
And you feel bloated at the end of the day.
Yeah, that's one of the symptoms. So most likely actually suffer from irritable bowel syndrome.
All right, so let's talk about the symptoms one more time so that people can get to understand what the symptoms are when it comes to irritable bowel syndrome.
One of the commonest symptoms is abdominal pain, and usually the pain is vague and it's generalized. It's not localized on one area. Unlike pain with ulcers and acids, that one is usually we call it epigastric pain. It's above the navel or above the umbilicus and below the rib cage. That's where you get it when it's acids or ulcers. But with irritable bowel syndrome, it's generalized. It's affecting the whole abdomen. And usually the pain comes for a day and then it goes away. It really lasts beyond a day. So that's one. Then secondly, you're bloated. You feel like your abdomen is full, yet you haven't even eaten that much. Then thirdly, you get belching. That's another symptom of irritable bowel syndrome. Then fourthly, you get what is called boborygm. Boborygm, it's a term that we use for abdominal sounds, abnormal abdominal sounds. You feel your abdomen is making these rumbling sounds, whether you're hungry or not. Those are also signs of irritable bowel syndrome. Then constipation or diarrhea. And you might have both. In one day, you get constipated and you get diarrhea in the same day. Yeah, alternating bowel habits. It's also typical of irritable bowel syndrome. Yeah.
All right. So what can you actually get to do? Is it treatable first and foremost?
It's a chronic condition and there is no cure.
Oh, wow.
Yeah, there's no cure to it because the cause is also not really known. It's all these are postulations, the high fiber, low fiber diet and the genetic factor. I also think it's also neuronal, that there is what we call the brain abdominal axis. So if there is no communication from the brain or proper communication from the brain to the intestines, then you get this problem. So there are a lot of theses or hypotheses about what really causes it. So because of that, it's difficult to get a cure. But we only know things that if you do this, it might improve. Then there are certain drugs that if you give you these drugs, it will go away, but recurrence rates are very high. That's why I call it a chronic condition. You don't need to be taking medication every day, but when it's high, we give you the medication, then maybe take it for a few days, a week, then you're good.
I'm worried.
Don't be worried.
I'm worried.
The good thing, it doesn't kill. It doesn't cause cancer. It doesn't cause a lot of other serious conditions.
Okay.
Yeah.
That's fine. We'll want to hear from you guys. So do get in touch with us by giving us a call, 498-652 and 498-654. You can also get to come through on our Facebook page at Power FM Zimbabwe via our comment section. We will be taking your questions. If you have anything that you'd like to ask about irritable bowel syndrome, also known as by us, who are not in the medical field, as irregular bowel movements, whereby you are not going to the bathroom as often as you should. Now, doctor did mention that you are supposed to go for at least a maximum of 3 times a day and within 3 days as well. So it can be twice in 3 days, or it can be at least 3 times in 1 day, or if it does get to proceed beyond, basically, you said beyond how many days?
If you go beyond 3 days not going, then there's a problem. So the minimum is once in 3 days and the maximum 3 times in a day.
Minimum once in 3 days?
Yes.
Maximum 3 times in 1 day?
Exactly.
Yes, 498-652. and 498-654. Good morning, how are you? All right, give us a call, come through, or you can come through via our comment section, all right? That is on our Facebook page at Power FM Zimbabwe. Good morning. Morning, how are you?
I'm not fine, actually.
All right, you can get to ask doctor.
I experience everything the doctors explained.
Yes.
I eat vegetables, I eat fiber, I eat but those things give me gas, and I feel so bloated. And I also think it's hereditary, because growing up I didn't have these issues. When I was older, I then asked my dad and his siblings. Turns out everyone has the same problem.
All right. Yeah, it's possible that can run within families. If it's not going away with dietary changes, high fiber diet, drinking plenty of water, then it means you may need to be treated. And might also need, there are certain probiotics that have been proven to work for the gut. If you go to the pharmacy, you can ask for some probiotics, gut probiotics. They will help stabilize your gut movements and all that. So you could try with that first. If it doesn't work out, then you can go and see a doctor. There are certain drugs that can give you prescription drugs, like a hyoscine, that if you take that one, usually it stabilizes your intestines, because the main reason why people do get irritable bowel syndrome is because of improper contractions. Normally when you're having peristalsis, when the food is moving, you should contract in a sequential manner, like this part contracts, then the next part. But with irritable bowel syndrome, you contract here and then you skip a segment, then you contract here. Then this part that is left in between will trap the gas and the air, and then causes the pain and the bloatedness and all these symptoms.
Yeah, because it gets so bad. Can you repeat that drug again?
Yeah, it's called hyoscine, but unfortunately this one you might need a prescription. But what you can start with probiotics that you can go and get from the pharmacy. You can just ask them for gut probiotics, then they can sell them to you.
Gosh, I'll do that.
All right.
Thank you so much for coming through. Now, doctor, you did talk about probiotics. Now, with probiotics, they come in different strength forms.
Yes.
I think there's 5, there's 10.
Yeah, there are 5, 10s, and 20s.
So what strain do you get? Because with probiotics, if you're taking it as a supplement, it also works for us as women, for our girl down there.
Yeah, there are certain probiotics with certain bacteria. Because probiotics, they're made of bacteria.
Okay.
So in the gut, there are some bacteria that are in the gut. So there are some good bacteria and some bad bacteria. So we'll give you more of the good ones. That will help you with digestion, because the bacteria in the gut flora is important for digestion. Then there are also bacteria down there in the vagina. So the probiotics for the vagina are different from the probiotics for the gut.
Can I take both probiotics for the vagina and then probiotics for the gut?
Yes, you can.
Or you can take them separately.
You can take separately.
All right, that's fine. 498-652 and 498-654. Those are the calling lines. You can also get to come through on our WhatsApp. No, not on our WhatsApp platform number. On our Facebook page at Power FM Zimbabwe. In the comment section, we do have this one saying, "Dine problem yekuti mudumbu mangu munorira way beyond, and I have just realized that I'm now I think it's belching,
Okay.
more than usual. How can I be helped?"
Yeah, if kana mudumbu mchirira like that, that's what we call boborigim. It's a sign of irritable bowel syndrome, and combined with belching, it means there is a lot of gas that is being trapped. Usually that one you need the hyoscine. It will help stabilize like the contractions, like I say, and then you won't trap gas, then you won't have boborigim, and you also have you won't have belching.
So they need to visit the doctor.
They need to visit the doctor and get this drug called hyoscine.
All right.
Yeah.
Good morning. You're live on Power.
Hi, how are you?
Fine, thanks. And yourself?
Yeah, I think same problem. I go for even once in 2 weeks.
What?
Oh, you are even worse than me. You are worse than me. Yeah.
Will you be eating every day, or I just want to understand?
Hello?
Will you be eating every day when you go once in 2 weeks?
Yes, I'll be eating every day.
Like a normal 3 meals in a day, normal balanced diet?
Yes. And I drink loads of water. Lots of water. But zvakatanga ndichiri mudiki, because ndaimbove neproblem yemawems ndiri mudiki, saka ndakutya kuenda kuloop.
All right.
Chazondipa problem here pamberi apo, or it's just normal?
Usually it's once in 2 weeks is just too much. Chances of you having serious problems like cancer or chronic conditions are very slim. It's just your lifestyle that will be affected yet. But try and go more frequently. If you're like that, I would really encourage that you maybe get some laxatives. It could help you to go a bit more frequently.
Okay, but when in the past I don't have any problems. I didn't have constipation and what or anything.
Quantity.
Normal. Even if I go 1 to 2 weeks.
Yeah, Yeah, my worry is maybe your bowels will be too distended, because if you're keeping all this food and all these feces for 2 weeks, it's too much. So I'd encourage that maybe once in 3-4 days, just get a laxative, then you just go and clear your bowels.
It's okay. Thank you very much.
All right, before you go, darling, doctor did ask about the quantity of your poop. Is it isho ma kana take one?
It's normal. Normal. I don't know why say that's normal. It's so much over, but
I na kuandas as well. Okay, that's fine. Thank you so much for coming through. Oh, Doc, you see, I said at least once. Once in 5 days.
Better.
I'm better. Once in 5 days. Good morning. How are you?
morning, Rachel. Morning, Dr. Joe.
Good morning. How are you, madam?
I'm all right. I must just first say you are doing such a great job. I'm always programming every day. I just got something different from what we are discussing about.
Okay.
I was diagnosed with fibroids because last week it was about this okay and what. But without the doctor.
Sure.
My fibroids, because that was 2014 when I was diagnosed. Can baby cancerous at the end, the Kanaka.
All right. First of all, thank you so much for the generous compliment. Fibroids are really likely to become cancerous. It's highly unlikely for fibroids to become cancerous. You generally don't treat fibroids because you're scared of cancer. It's highly unlikely, less than 1% probability of it becoming them becoming cancerous. But if you've got other issues, how old are you now?
48.
48.
Yes.
Yeah, 48 probably are now getting into menopause. Usually once you get into menopause and stuff, they start shrinking and the symptoms will be less. Are you bleeding too much on your periods and stuff?
Yeah, at times apparently I'm on a control because they can't consider off, but otherwise for now the doctor, the guy said I must check with the control condition there, but it will control the bleeding.
If the bleeding is controlled, then you can just delay. You don't need to rush for the operation because one, I'm assuming you don't want to have a baby anytime soon. Then also
no, nothing like that.
which is good, which means you can just delay and continue using the control. If the bleeding is well controlled, then you can just delay after during menopause and after menopause. The fibroids generally shrink and become smaller, and they won't give you any problems.
Thank you so much, doctor. You know, people talk. They can say, be cancerous because I've been on them for the past 8 years now.
Yeah.
Yes.
They won't become cancerous.
It's all right, doctor. Thank you
so much for calling.
Whatever you're doing, thanks, Rachel.
All right, thank you. All right, we have 5 minutes before 11 o'clock. 498-652 and 498-654. We're going to try and pick one more call as we are talking about irritable bowel syndrome, whereby you have irregular movements when it comes to your bowels, when it comes to your poop. And that's what we're talking about basically. So Doc did say that a minimum of once in 3 days, a maximum of 3 times a day. That should be normal. Good morning. How are you? Hello. Good morning. Fine, thanks. And yourself? Can you hear us? All right, we got a bad connection there. Four 652 and 498-654. Good morning. How are you? Hello. Good morning. All right. So when you come through, please reduce the volume of your radio so that we are able to hear you. Hi there, Miss Rachel and Doc. Ini my 4-month anorira mudumbu too much. Even ukamupa baby food maybe. Joramba Shingodaro wanted to know if there is something I can do. Is it normal is it actually a possibility that babies can get to experience irritable bowel syndrome?
We say normally the diagnosis of irritable bowel syndrome usually occurs a bit certain oldish age, after 12 years going on. It's rare to get it before that. Usually at 4 months, they're still young, the intestines are still developing, you might get a bit of colic and stuff like that. And the rumbling sounds, they're common, not that they've got irritable bowel syndrome. The other problem that I see is they're already feeding the baby at 4 months. Generally want to get to 6 months of exclusive breast milk. So infections start coming in and all those things, because also infections can also play a part in irritable bowel syndrome. syndrome, by the way. So please try and give the baby more breast milk. Usually the intestines are still adjusting. So for you to introduce baby foods is still a bit early. We want you to start feeding the baby with other feeds after 6 months.
So exclusive breastfeeding for the first 6 months.
Yes. Kana mvura, kana oil. Some say I need to lubricate the intestines, so they give their cooking oil.
Yes, I've heard that before.
Yeah.
Okay, so that's not acceptable. All right, fine, Doc. So your recommendations for those who actually suffer from irritable bowel syndrome?
So if you're suffering from irritable bowel syndrome, number 1, eat a lot of fruits. Number 2, a lot of vegetables. Number 3, drink a lot of water. And also exercising helps with the gut motility. People who are stressed and people who are depressed are also at a high risk of developing irritable bowel syndrome. So avoid stress, avoid depression, exercise, eat more fruits, eat more vegetables. That way you minimize the chance of having recurrent attacks of irritable bowel syndrome.
Before you go, Doc, we've got a very important question to ask here.
Okay.
We've got someone who's saying that, their child goes to the toilet at least 5 times a day. They're only 1 year old. Is this normal for a 1 year old?
It's a bit too much for a 1 year old to be going 5 times a day. At times with kids, it depends on also what you're feeding them with and how often. If you're overfeeding the child, the bowel motions will also be higher because the abdomen is small, the intestines are small, so they won't be able to contain all the food. And would have loved to know if the food is coming out well digested or indigested. That will also help us to see what exactly is the problem. So yes, 5 times a day is too much. I would suggest that take the child to the pediatrician and get to discuss about it. And also if the stool is loose, there could be a bacterial infection.
All right, that's fine. If people want to get in touch with you, Doc, how can they do so?
On Facebook, Instagram, and Twitter, it's Dr. Joe 263.
My on Twitter, Doc. Hey!
Not Twitter.
You're on Twitter. Okay. Interesting.
Yeah. So soon I'll be on TikTok. And posting some reels.
Okay, so it's Dr. Joe.
Dr. Joe 263.
Okay.
Yes. Then WhatsApp 0719 395 231. 0719 395 231.
All right. Thank you so much to Dr. Joe for coming through, our resident doctor right here on The Connection. And today we're talking about irritable bowel syndrome, what we know as irritable bowel movements or irregular bowel movements. And he was just explaining to us that if you're regular, it's at least a minimum of once in 3 days or 3 times a day on a maximum level. If it's anything more or less, then that means there's definitely a problem. Thank you so much to Dr. Joe. This is Power FM Zimbabwe, The Connection. And it is time for the news. Do check your time with us. It's 11 o'clock.